Students of MSc in Nutrition and Dietetics invite you to move on to our next session on nutraceuticals, functional foods, and supplements. The session focuses on improving the nutrition of the population and the nutritional status through mitigating nutrient deficiencies. It would provide insights into different methods to improve the nutrient intakes of individuals using functional foods, nutraceuticals, or food supplements. Increasingly, the use of foods as a whole, a part of, or as isolated components is being widely recognized for their health benefits and for the prevention of chronic diseases. Moreover, it offers insights into food fads and fallacies which are commonly observed among the vulnerable populations of the community.
To begin with the session, we would like to introduce our speaker, Dr. A.J. Hemamalini, Professor and Head, Department of Clinical Nutrition, Sri Ramachandra Faculty of Allied Health Sciences, Sri Ramachandra Institute of Higher Education and Research, Chennai. Ma'am has obtained her RD Registered Dietitian credential in 2012. She has been working professionally as a dietitian and academician since 1995. She is also an active member of the Indian Dietetic Association, Nutrition Society of India, and many others. She has also published various research papers in high-impact journals. We welcome you, ma'am. Next, we would like to introduce and welcome Ms. Smeetal Furtado, Senior Nutritionist and Dietitian, Qua Nutrition Clinics, Mumbai. Ma'am is also a quality check and supplement strategist. She has completed various internships and laboratory trainings related to the fields of food safety and nutrition. She is a member of the Association of Food Scientists and Technologists, Mumbai chapter. We welcome you, ma'am.
Our third panelist is Dr. Mei Lan, who is an associate professor at the School of Pharmacy, University Sains, Malaysia. She is also a registered pharmacist. She has published several internationally peer-reviewed publications in high-impact journals. Her research contributes to the extensive safety information and drug-herb-food interaction risk data on local functional foods, supplements, and herbal components in order to promote their appropriate use. Welcome, ma'am.
We have today with us an eminent researcher and industry representative, Dr. Pawan K. Singh, President, R&D, BVJ Life Science Limited, Pune. We welcome you to the panel discussion, sir. BVJ Life Sciences Limited has been conferred with the Herbal Industry Leader Award 2021 to recognize contributions and scientifically oriented developments in herbal and Ayurvedic drugs.
The anchor for this session is Dr. Kavitha Menon, Professor and Head of Department, Nutrition and Dietetics, SYMHEALTH Institute of Health Sciences. She was also an Associate Professor of Nutrition at the Public Health Foundation of India and an Executive Council member of the Nutrition Society of India. She has worked as an academician and as a researcher in India, Malaysia, and New Zealand. She has received numerous national and international research awards for innovative research work.
We now request our panelists to come onto the stage. We also request Dr. Kavitha Menon, ma'am, to anchor the session.
Good morning, all. Very happy to anchor this session because this is a very important topic and very often used for not knowing how to use it. I am extremely happy that we have very eminent speakers for this session from academia, industry, and practice side. They have been introduced by my team already. So let me set the objective for this panel discussion. The speakers will be talking about the importance of supplements, and we'll be talking about different types of supplements, which is the highlight of the session. Dietary supplements, nutraceuticals and functional foods. We'll have sports supplements, and then herbal and Ayurvedic supplements. And also we'll look into the importance, its beneficial and adverse effects, and how to optimize these supplements to improve the nutritional status in health and disease. A few guidelines for the speakers I have already communicated, but still, We have 4 panelists, so we will limit our presentation to 10 to 12 minutes, following which, once all the participants and panelists speak, we'll have a discussion. Thank you. Now, I invite Dr. A.J. Hemamalini to take over, and we'll listen to the importance of dietary supplements in nutrition and health. Welcome, ma'am.
Very good morning to all of you here. Thank you, Dr. Kavitha, for inviting me and to meet all this august audience here. And it's a wonderfully organized program. And I also thank the hospitality that was showered on me today morning. And this is the topic on dietary supplements. And there may be some other talks like what are the different dietary supplements. Dr. Kavitha gave a small introduction as to there are multiple. When I use the word supplement, there are multiple products in multiple names, okay? So I'm just going to concentrate on what is my clinical expertise. So my session outline is going to be like this, quickly. Just wanted to define what are dietary supplements, what are the different categories of the supplements, and my focus will be on the scientific formulas that we use in the clinical setup as supplements, and what are the clinical benefits, regulations, dosage, and so on. So this is how it's going to be. And as we were discussing or listening to the previous speaker, we know how the healthcare industry is booming in India, becoming the medical tourism hub of the world. Similarly, even this nutraceutical market, or what we call as a supplemental market, is also growing, and growing in leaps and bounds. So as we are all people from different specialities that I understand. So we also have a lot of challenge and need to cater to this growing and evolving field. As far as nutrition supplements or dietary supplements, what I'm going to focus is concerned. First, we have to understand what are dietary supplements. They can be anything like, so the dietary ingredient, which include, it can be vitamins, minerals, amino acids, herbs, botanicals, as well as other substances that can be used to supplement the diet. So many of us are much more familiar in vitamins and minerals. Many people, the layperson, just pop in vitamins and minerals across the counter every day also. There's a lot of recommendations or apprehension about it, whether it is really required to be taken every day. So traditionally, products designed to supplement the diets are basically with essential nutrients, and they have been regulated by, not too much of regulation, but they have to have the standard label. The Dietary Health Supplement Education Act, according to this, they have to have the standard label, but though there is no recommendation for dosage, or even some of them they don't have for constituents also. As we look at here, these are the different types of supplements that are available, the dietary supplements. The first in list is vitamins and minerals. You could see that 98%, as I was just mentioning, 98% of the people pop up the vitamin and mineral supplements, whether it is a need or not a need. I'll just touch upon what will happen if it is taken without a requirement as such. And there are also specialty supplements comes in the next 46%, and that is what I'm going to deal with as a clinical nutrition background. And probably there are some more people who will be working on this herbal, sports nutrition, and weight management. So this is what is the market of these categories of supplements. So specialty supplements, I just move on to the topic. So we use in our clinical setup different types of supplements. You could see here there are multiple variants. The basic categories, as you could see, is, we call it as not commercial, but it is scientific products. And there are also possible liquid foods and blenderized, wherein you have oligomeric, that is elemental, semi-elemental, and peptide-based feeds. These are commonly used when the people have a compromised digestive function. And there are disease-specific. There are multiple companies coming up with disease-specific products, which we choose from. And this, we call it as modular products, where only a component is modified and made into use. So if I want to increase the protein requirement or protein intake of an individual, a client, I just go for a modular formula which has a high protein. So like that, we have multiple products in the market for the clinical scenario, and from where we clinical nutritionists choose it. And this is how we go with the algorithm. How do I decide on what formula I want to use. So depending on the nutritional assessment, I understand there are nutrition students also here. So there is specific formula with intestinal failure. If there is no disease-specific formulas, which is too many other things, and even recent regulations says may not be required to use disease-specific formula, but for our interest of learning, I have included that here. And there are multiple oligomeric formulas. If there is no stress, okay, the high protein formula or normal protein formula. So we choose from the market depending on what type of formula we want for the client. And the formulas normally will have an isocaloric density, that is 1 calorie per ml. If I give 500 ml, I will be able to give 500 kilocalories and so on. And there are sometimes fluid restricted formula or a calorie dense formula, which is 1.2 or 2 cal per ml. And there are also formulas which are enhanced with fructose oligosaccharide, which is the soluble fiber, because in patients, whether orally or enterally being fed, fiber is also very important. So for us to provide this many different formulas, the so many what I was discussing about, we have multiple players in the market, multiple of them. Some of them only have been introduced or been listed here. It is ever grooming or ever booming industry. Everyone comes with some difference in their constituents, and it is growing in any, this thing that we could imagine. So I'm just bringing here some of the ingredients or some of the indications that these players tell us, based on which we, the clinicians or the clinical nutritionists, choose from. So here we have to look at, forget about this, the brand name, but here you have to look at what are the ingredients that they use commonly. Okay, soybean oil, guar gum. There are some. This is a glutamine, which is an immune-enhancing nutrient, and how it is to be reconstituted. What is the nutritive value? So these are the something which helps us to decide what are the formulas that I need to use. So for us, this is most important, where we look at the maltodextrins. What is the source of protein in this particular product? What is the source of fat, and so on. So this is a deciding character for us to use or choose the particular formula. And there are also some pediatric formulas that are available, which we can use for our pediatric clients. These are the supplements, and I think prior Dr. Kavitha was giving an instruction as to how to prepare or how to use it. That is very, very important. That's why I've just put here. We look at, based on how we want to progress. When I initiate a supplement, how we want to progress. So we look at the reconstitution in very clearly, whether it is to be mixed with water, whether it is to be mixed with milk, or how many scoops at the dosage level. I can't exceed this. If I exceed this, there can be possibility of osmotic diarrhea or constipation. Both are possible. So as healthcare provider, we have to be very careful about choosing the reconstitution detail. And adding on to the confusion, or adding on to the facility, is the probiotic supplements. A lot of research is coming up where it says probiotic is helpful in improving the GI function, GI integrity, and also the prevention of or controlling many oxidative stress-oriented diseases and so on. Amino acids we were talking about. These are a couple of amino acids which are in the market. Arginine and glutamine. They also come as supplements, which we will be looking at. And this is just, the different cases that we have been treating in our university hospital, where we have used different formulas, the kind of cases that we look at. We do the nutritional assessment based on the MET and deficit. When we do the 24-hour dietary recall, and we compare with the estimations, and we say that the patient has met only 30% or 20% of the estimated requirements, and therefore the nutrition supplements or the dietary supplement comes in. Okay? So just to wind up another couple of slides, what happens is the public health messages advocate supplements in specific circumstances, but not in optimally nourished patients. And it should be only based on their clinical or critical condition. It is not that for anybody and everybody we use the dietary supplements. So they are varied in nature, are prescribed to meet the requirements. Formula selection is based on the type of the nutrients. And if it is going to be selected just like that, it can be harmful in leading to toxicity. vitamins and minerals also have their toxicity. Liver is required to metabolize whatever is being taken. Similarly, other dietary supplements also is metabolized by the liver and excreted by the kidney. So if I use unduly the dietary supplements, I'm going to add on confusion to the already underlying clinical problem. So therefore, as healthcare providers, we need to be familiar with the multiple options that are available, but judiciously choose based on the clinical condition and the client's requirement. Thank you for listening. And there are also regulations. FSSAI is something what I have put. This is a link which we can go through and get a lot of insights into how they are regulated for use, recommended for use. Thank you.